you, Madam Deputy Speaker, and can I welcome my honourable friend, the Minister, to her role. It's a great pleasure to speak in this debate to support this genuinely world-leading piece of public health legislation to help consign smoking to the history books. Unless we act to help people stay healthy, the rising tide of ill health in our society threatens to overwhelm our NHS. Empowering back public health, as the last government did, was the definition of penny wise but pound foolish. It is vital we tackle the causes of ill health, not just the symptoms, so we can save the taxpayer billions, but most importantly, save lives. We know that prevention is better than cure. And we've heard today smoking remains the single biggest preventable cause of ill health in our country, causing 80,000 deaths a year, responsible for 1 in 4 cancer deaths, and it is a factor in over 70% of lung cancer cases. In my own constituency alone, nearly 12,000 people smoke. They are more likely to leave the workforce due to ill health. Many will suffer strokes, heart attacks, conditions like chronic obstructive pulmonary disease, and on average, they will lose 10 years of life expectancy. But the real tragedy of this is how many thousands of these smokers will have started when they were children, when they didn't know any better and simply have never been able to quit. And most smokers report wishing that they had never started, which is why it is incumbent on us all to support this legislation to help stop the start. According to Ash, in my constituency alone, the cost of smoking exceeds 90 million every year, including 56 million in lost productivity, 4 million drained from the NHS and 30.7 million in social care. And the costs of smoking to our society are enormous, and that is why it is time to stub it out. Even today, in 2025, hundreds of young people a day take the first drag of a habit they will never manage to kick and will regret for the rest of their lives. I was proud to lead the opposition's response to the last government's bill through committee in the last parliament, and as I said then, there is no freedom in addiction. It is a shame that the Conservative Party leader allowed her ideology to blind her from that fact when she voted against this legislation in the last parliament and in this one. Where the last government failed to get the tobacco and vapes bill over line, this government will get the job done. But I am proud that the government has vastly improved on the legislation that the last government drew up. Firstly, the introduction of a new licensing regime to cover tobacco and nicotine products, including vapes, is hugely welcome. This was a key recommendation of the Khan Review in 2022, which the last government largely ignored, and which retailers and the public overwhelmingly support, according to the surveys conducted by Ash. The status quo, where there was no requirement to obtain a licence to sell these products, is a major gap in enforcement, particularly when you consider that the sale of alcohol is licensed, while nicotine and tobacco are not. Secondly, I'm pleased that the government is taking forward an amendment I tabled in committee during the last parliament for the introduction of £200 on-the-spot fines for retailers selling products to people underage. In 2019 to 2020, of the councils who undertook test purchasing, 50% reported that cigarettes or tobacco products were sold to children who were under 18 in at least one premise. That evidence is that the current regime is not enough of a deterrent. And the introduction of new on-the-spot fines, double the amount the last government proposed, will be much easier to issue and much harder to ignore. So does the Minister agree with me that double the fine is double the deterrent? And thirdly, I want to commend ministers on the action that they are taking on vapes. Under the last government, youth vaping trebled in 2 years. An estimated 1 in 3 vapes on the market were illicit, products often containing harmful chemicals, heavy metals, or even drugs. These gaping loopholes were left to sit on the statute books for years, putting children at risk. The promulgation of dangerous illicit vapes in shops, schools and on our streets is a real concern. Recently in Birmingham, trading standards and the police led raids on retailers under Operation Cloud, where they seized nearly £6 million worth of illicit vapes, tobacco and drugs. One raid alone, the biggest ever in Birmingham, clawed £1 million of goods out of criminals' hands. It shows the extent of the problem regarding the illicit market and the incredible job that council trading standards teams do to keep the public safe. I therefore thank the government for getting behind trading standards with a 10 million boost to support their work next year. And in particular, I want to welcome the new government's introduction of clauses to this bill to set up a testing regime for vapes, a proposal that I championed in the last parliament. It is shocking that under the current rules, and unlike tobacco, there is no testing regime for vaping products. It means that dodgy products can be rubber stamped by the British regulator and wind up on our shelves, undermining the valuable enforcement work that trading standards do to identify and seize unnotified products. As testing of vapes marketed at young people has shown, a significant proportion of vaping products aren't what they say they are. Some market themselves as 0% nicotine, but they're not, leading to accidental addictions. Others contain harmful substances like heavy metals and even antifreeze. This was evidenced by research from Interscientific. And that is why, during the last Parliament, I tabled amendments that would have established a new testing regime for vapes. Unfortunately, the Conservatives voted them down. So I want to commend ministers for introducing powers that the last government snubbed. Nearly 3 million people have quit smoking using vapes. Clearly, they have a role to play in the transition to a smoke-free future. But if they are to be used as a stop-smoking aid, we need confidence that the products people buy are safe. And that is what routine testing would do. Finally, I want to commend the government on amendments that have strengthened this bill, closing the loopholes on vape vending machines and banning vape advertising, promotions and sponsorships. These clauses will ensure that these products are kept away from the impressionable eyes of young people, so the next generation is not simply substituting one nicotine addiction for another. There were significant holes in the last government's plan, and I'm glad the new government is slamming them shut. Madam Deputy Speaker, the health crisis facing our country was never one that has been confined to the running of the hospital wards, doctor surgeries and dental practices of our country. We are a sicker nation, and that public health challenge needs confronting too. Life expectancy was extended by 3.5 years over the course of the last government, but in the 14 years under the Tories, it grew by just 4 months. In this bill, we see the epitome of the future-facing approach that only a Labour government can deliver. By stopping the start, ensuring that the next generation never develop an addiction to nicotine, we can protect their health and well-being and our NHS for many years to come. Thank you.